Welcome back to another episode of Diabetes 180. For those of you tuning in for the first time, my name is Lewis Bertus. I'm a physician assistant and I teach how to reverse diabetes. Today's video is one that covers something that we can all relate with. By show of hands, how many of us have failed a health commitment, a health habit that you committed to start or undo? I think everybody's hand should be up, right? All of us know the pain of starting the year or the day or the week with a commitment, and whether it be drinking more water, exercising, eating healthy. You start off really strong, but in the end, at the end of the year or the end of that day or week, you're right back where you started. This is a common phenomenon known to man. You know, we have our health commitments and we fail at them time and time again, no matter how much our good intentions. So in this video, I want to break down a method that is going to show you how you can stop this cycle of sabotaging yourself. All of us know about that voice inside that seems to self-sabotage our good intentions. In psychology, or Freud calls it id. In science, they call it the limbic system. And the Bible calls it the flesh. I just call it the devil. You know, because it seems like every time you want to do good, evil is right there with us. So this method that I want to teach you is called implementation intentions. And I want you to pay attention to this whole video. Watch it to the end, because not only am I going to show you what implementation intention is, but I'm going to give you 3 reasons why it works to motivate you to try it and find how powerful it is to end self-sabotaging using this method. Let's start off with the textbook definition, according to Wikipedia. Implementation intention is a self-regulatory strategy in the form of an if-then plan that can lead to better goal attainment, as well as help in habit and behavior modification. So here's an example of this at work. An experiment was performed that collected hundreds of middle-aged women and split them into 2 groups. Both groups were instructed and educated on the importance of eating fruits and vegetables, and both groups were encouraged to increase their intake of fruits and vegetables. The difference was that one group was given no instruction on how to do this. They were left to do it on their own. And the other group was given the direction of creating implementation intentions. For example, they were to write down, if I have no fruits at work, then I will buy an apple from the canteen. For another example, if I'm eating out, then I will order a salad. So in the beginning, both groups, you can see, were kind of head to head in increasing their consumption of fruits and vegetables. After 2 years, it turns out that the group that did not have any plan, let alone an implementation intention plan, went back to their baseline consumption of fruits and vegetables. However, the group of women that had written down an implementation intention plan, not only were they continuing to eat more fruit, but they were significantly higher in their consumption of fruits and vegetables than when they first started the experiment. So this is just one of many experiments that have been done to show how effective implementation intentions really can be. And of course, I wouldn't be teaching it unless it worked for myself. I love Snickers. Every time I was done with work, of course, because I work hard and I deserve a stress reliever, I would snack on some Snickers, wash it down with a nice ice cold Pepsi. If I was feeling, a little extra special, I'd add some chips on the side. And that was my snack on the way home almost every single day. 40 pounds later, I was like, something got to change. So I created an implementation intention, and I made sure that it was specific, right? Especially specific to the situation in which I found myself craving this unhealthy food. So what I did is I replaced the Snickers and the chips and the soda with mixed nuts and raisins in my car. And I said to myself, I will always keep mixed nuts and raisins in my car, so if I'm craving a salty or sugary snack, then I will snack on something healthy. And I can't tell you the last time I had a Snickers bar. Actually, if I can recall, the last time I tried one, it was disgusting. I was just like, man, how do I even enjoy this thing? So this shows you how powerful it is to stop sabotaging yourself when you actually have a written specific if-then scenario to apply and make a new habit. There's 3 reasons why this works. The first reason is it puts you in control. You see, the thing about cravings and bad habits is that over time it becomes almost automatic. It's like a subconscious drive, or as I call it, the devil, that pushes you beyond your even frontal lobe knowing what's going on. Your conscious mind is in the backseat. So when you actually have an implementation intention, an if-then plan, you put your frontal lobe back in the front seat. You take control, and now it's you making decisions. You deciding when to indulge and when to let go of those habits. Number 2, it keeps you from quitting. See, the problem with just trying to have a good intention when it comes to healthy habits is that when you break that good intention, it leads to a feeling of failure and defeat. And nobody likes feeling defeated. Nobody likes feeling failure. So you just give up on the good intention altogether. But when you actually have a plan, now you know if one plan fails, just make another one, right? Maybe that first one was not specific enough, or maybe it was too strict. Just rewrite a plan and keep it moving. The third reason why this method works is because it allows time for new habits to form. So whenever you have a bad habit, it's going to take a while to break it, right? I didn't just get rid of Snickers overnight. Trust me, guys. But the beautiful thing is if you create a good habit, it over time will overpower and replace the bad habit. And that's what implementation intentions allows. It allows time for new habits to replace bad habits. All right, so what is an implementation intention that you can make today? Let us know in the comments section. I'd also like to give you an opportunity to get a great tool to jumpstart on your health. This is a traffic light system. It allows you to see the foods that should be increased in your diet while also going in moderation or eliminating the foods that are harmful to your health, especially for diabetes, right? So green means go, yellow means moderation, red means slow down a bit, preferably eliminate it. And this will be yours in the description section. So I hope you enjoyed this video, and I hope to see you in the next one. Next week, every Friday, I try to put out a new video. So definitely subscribe and hit the alert button so that you could always know when Diabetes 180 has a video for you to watch. All right, see you next week.